player's quite tanked up here from Luminosity, so Hiko definitely not going down without a fight. Oh wow, there's the first fast frag. Hiko gets a double. Oh my goodness, how does he do this? How does Hiko do it again?
This is right now, they got two already. Bang is hiding, he's coming. Bang looking to come in, here comes your initiation, there is through. Oh my god, your shockwave will find them all.
Esports is one of the fastest growing industries in the world. From recreational play to professional athletes, competitive video gaming is progressively becoming part of the mainstream in the sporting community. In the last year alone, esports viewership has increased from 443 million to 495 million globally. The rise in popularity has created a market for the creation of professional teams, franchises, organisations and more recently, Olympic recognition. However, the cementation of esports into the world has left some important factors and considerations in its wake. The exponential growth of competitive gaming has dramatically changed the lifestyles of both professional and recreational gamers. Although this is excellent for the growth of the industry, the fallout of increased video game time is starting to emerge. One of the main and most obvious issues surrounding video games and esports is the sedentary lifestyle that comes along with prolonged game time. There's a plethora of evidence supporting the link between sedentary behaviour and poor physical health. A higher body mass index and low self-reported general health has been associated with an increase in gaming hours. Having a higher body mass index or BMI increases the risk of developing conditions such as type 2 diabetes, coronary heart disease and some types of cancer. It can also lead to psychological issues such as depression and low self-esteem. When it comes to esports athletes in particular, research has shown that players exhibit less muscle and bone mineral content along with a higher body fat percentage when compared to a control group of individuals. In addition to the issues surrounding body mass, other physiological detriments have been identified in esports players. In one study involving 65 collegiate esports players, 56% of gamers reported eye fatigue, 42% experienced neck and back pain, and 36% displayed wrist and hand pain. It was added that 40% of the participants didn't engage in any form of physical exercise and only 2% sought medical attention for their issues. Mental health in esports is another overlooked factor. There's a substantial lack of research focusing on the mental strains of performance, pressures of competing, prolonged practice times and coping with criticism from social media. Extensive video gaming, both recreational and professional, has been associated with increased levels of aggression, addictive behaviour and depression. Internet gaming disorder, or gaming addiction, is estimated to affect approximately 5 million people in the United States alone. Higher rates of anxiety, depression and alexithymia have been found in diagnosed individuals. It's been suggested that esports athletes should be screened for IGD and should have access to mental health professionals for support and potential treatment. Although there's some emerging research regarding the negative psychological effects of esports and video gaming, there are some great positives surrounding the social and psychological health benefits of gaming. The ability to meet and play with others around the world who share a passion for competition, exploring and role-playing has shown a positive effect on forming relationships, maintaining psychological well-being and life satisfaction. There has been a multitude of cases involving both physical and psychological health over the progressing years of esports. League of Legends icon Uzi, considered one of the best AD carries of all time, decided to step away from esports in June 2020 due to his diagnosis of type 2 diabetes, saying that chronic stress, obesity, irregular diet, staying up late and other reasons were the main contributor. Hai, a League of Legends mid laner who played for Cloud9 during the 2014 season, was hospitalised due to a medical condition called spontaneous pneumothorax, also known as sudden collapsed lung. Hai briefly retired due to this issue along with a wrist injury before returning to competitive play in 2015. This wasn't the first and only case though. There are 4 other esports professionals that have experienced sudden collapsed lung, including Overwatch's Janus, CSGO's Glaive, League of Legends Mylon and StarCraft's Seongchil or SC. There isn't enough data or evidence to form any correlations, but it's been suggested that poor management of physical health, nutrition and posture could be the reasons behind these increasing occurrences. An emerging concern in the esports scene is the use of performance-enhancing drugs. Although it hasn't been vocalised, the use of attention deficit hyperactivity disorder drugs such as Adderall and Ritalin which is suggested to improve cognitive function and concentration, is on the rise. An interview with CSGO player Corey Semphis-Friesen reported that the entire Cloud9 team, including himself, were using Adderall in the ESL-1 Katowice LAN event in 2015. Although there are policies in place that prohibits the use of drugs and alcohol during performance, there needs to be a raised awareness regarding to the physical and psychological risks of drug use within the ever-growing esports community. Repetitive strain injuries, high BMI and mental health issues could be considered mere byproducts of the esports athlete lifestyle. The necessity of prolonged practice, the pressures on performance outcome, as well as the personal ventures of streaming and content creation to retain financial stability, seemingly leaves little room for the upkeep of health and well-being, which is why this needs to change. To address the lack of emphasis on personal health and well-being in esports, here are some proposed interventions to help combat the existing issues that have been outlined so far, as well as raising awareness for the need of research into this area, which in turn could pave the way for future policies and practices to be formulated. According to government guidelines, individuals should complete 150 minutes of physical activity per week. A combination of aerobic exercise and resistance training can assist in reducing BMI, increasing muscle mass, improving bone density, and posture. Postural retraining and protective exercises are suitable interventions for reducing RSIs. Body positioning and desk setup should also be considered. Factors like chair support, desk height, and monitor distance can detrimentally impact performance if the correct measures aren't available or haven't been implemented. Additionally, there needs to be an emphasis on regular active rest periods throughout practice and playtimes. One study found that performing calisthenics to break up sedentary time was a more effective form of energy expenditure compared to just standing or walking around. Completing a set of calisthenic exercises such as squats and lunges can break up the hours spent sitting during practice and performance time. Regular physical activity can also have a positive effect on cognitive performance. A study involving 1,800 adolescents found that participating in physical activity during leisure time can positively influence cognitive performance. So as well as improving overall health and well-being, there could be an opportunity to improve in-game performance through implementing an exercise regime into the lifestyles of esports athletes. Coinciding with the implementation of physical activity, providing educational interventions for nutrition, healthy sleep patterns and mental health literacy may facilitate the positive transformation of the esports lifestyle. Nutritional and dietary education has been suggested as a viable intervention for esports athletes, particularly collegiate athletes, due to the current connotations associated with being a professional player. Giving esports performers the access and opportunity to learn about balanced nutrition and calorie intake will develop a greater understanding and consideration of what they should be consuming. Sleep cycles in esports are predominantly unregulated and unstructured. Many esports athletes prioritise training time over sleep to enhance their performance. Sleep deprivation studies have found that response speed, an essential tool for an esports player, is actually worse in sleep-deprived individuals, implying a lack of sleep negatively impacts cognitive performance. Cognitive behavioural therapy tailored to esports athletes could be used to replace dysfunctional and unhelpful prerequisites surrounding sleep. Educating players about the importance of relaxation or wind-down time would also be a beneficial tool. Teaching techniques such as progressive muscle relaxation, breathing, and meditation could positively contribute to healthy sleep patterns amongst individual and team performers. Mental health literacy is defined as understanding how to obtain and maintain positive mental health, understanding mental health problems and their treatments, decreasing stigma to related mental health problems, and enhance help-seeking efficacy. MHL needs to be available and introduced into the esports community at both recreational and professional levels. Community and organisation campaigns would be the best way to raise awareness of mental health in esports. Additionally, providing coaches and managers with MHL for training purposes would facilitate a reliable support system for esports performers, which can lead to earlier interventions and prompt referrals to qualified, competent professionals when needed. Esports is growing at an exponential rate, but the scientific research surrounding it is not reciprocal. Physical health issues such as BMI, reduced muscle and bone mineral content, repetitive strain injuries and poor posture are prominent risk factors for esports players. Mental health issues such as anxiety, depression, aggression and internet gaming disorder are prevalent in the esports community. The increasing real-world cases of professional athletes regarding physical health, mental health and the use of performance-enhancing drugs needs to be highlighted and addressed as quickly and efficiently as possible. Physical activity interventions involving a diverse exercise regime comprising of both cardiorespiratory and resistance training for at least 150 minutes per week can promote healthy weight loss, increase muscle mass, improve posture, reduce and prevent repetitive strain injuries, and enhance cognitive performance. Educational interventions for nutrition, healthy sleep patterns, and mental health literacy could positively facilitate the transformation of the conventional esports athlete lifestyle, and provide a competent, structured support system for players to access and improve their understanding of why it's so important to consider the potential health risks associated with being an esports player. Thank you.